So my ex-wife's grandmother, who I called Nona, was a larger-than-life woman who loved everything, hugged you till you couldn't breathe when she greeted you, had this great thick Italian accent that I love to emulate. And she had metastatic breast cancer when I was at the beginning of my oncology training. And she was going through chemo after chemo through the years to the point where she was exhausted. And I remember one holiday when we were visiting her, she looked up to me and said, "Ben, do I have to take chemotherapy still?" And that nearly really broke my heart. It really was just in some ways a revelation of how we treat patients, but sometimes we're not thinking about the whole patient. And it led me to the realization that if therapies are worse than the disease we're trying to treat, we're not doing right by the patient. And it also led me to believe that we really need to dig deeper into our patients' history, what are they doing in their lives on a day-to-day basis, and how our treatments are affecting them, and that they can say no, and that that's okay. But it became really, really challenging for me when she eventually went into hospice, and I saw her at home, which was eventually her deathbed, and I looked at her, and here was this woman that I just described was so full of life, and I couldn't help her really in multiple ways. One, I couldn't give her any new therapies that would effectively save her life or at least extend her life. But I also didn't know the words or how to comfort her. And that was an aspect of my training and my career that eventually I think was good at developing, because as someone once said to me, to really be a good oncologist, it's just as important to help people or patients die as it is to help them live. And that was something that I hadn't really appreciated before, but it really resonates with me now. This is a profession that really exacts a lot, but also rewards a lot in our interactions with our patients. And that was really an inspiring event to me. As sad as it was and still is, it really has set me on a course of why I'm doing what I'm doing here.